Hey guys, thanks so much for following the Dr. Amy Show and Forum Chiropractic on Facebook. You're watching a best of the Dr. Amy Show. And if you'd like to book an appointment, call us at 239-628-4899, or you can always click the link below and book an appointment through Facebook. And as always, click like and please share with your friends if you find this content interesting. Thanks so much. Have a great day. You are tuned in with Dr. Amy Robbins. I am from Forum Chiropractic, located over at Colonial and 75. The best number to reach us is 239-628-4899. Again, that phone number is 239-628-4899. Again, you can always find us online at mydramy.com. That's mydram.com. This week, we are talking about problems and solutions, part 2. So, a couple weeks ago, we were talking about problems and solutions part 1, and we talked about if you have low back pain or blood pressure issues or weight loss resistance. Obviously, those are health problems that people deal with in society. So, what's the solution? Many times when you have these issues, you're told that the solution is to take a pill for every ill. And there is a pill for every ill, and you will never get off those medications. And it is the standard of care. So the standard of care is that, especially for certain things like blood pressure or cholesterol issues, the standard of care, meaning that's what the majority of doctors do, is they leave you on those medications for the rest of your life. Because according to the CDC, the Centers for Disease Control, that's the standard of care, is just to leave you on the medications to manage your problem for the rest of your life. Now, managing a problem and fixing the cause of the problem, fixing the problem, that seems like two totally different things. So managing is not fixing. All that you're doing with medications is managing a problem. You know, they say, you hear people talk about diabetes a lot, and they talk about, you know, I think there's it's either Walgreens or CVS, I don't remember which one, but they talk about, come to the pharmacy, we'll teach you how to manage your diabetes. And it gets me every single time because I'm like, listen, unless you have type 1 diabetes, which is rare, most people don't have type 1. If you have type 2 diabetes, that's the majority of people. You don't just need to manage it, figure out what caused it in the first place, because you weren't born with type 2 diabetes. So that means that you don't have to just manage it, you could actually fix it. So that's what we're going to get into today. Not specifically diabetes, even though I could go off on a trail about that, but we're going to start with shoulder issues. So many times when you start to have shoulder issues, the first place that you go to is, well, the first thing you'll do is ignore it, right? Especially if you're a man. You're so good at ignoring things. But even as women in today's, I know my producer is looking at me like, I can't believe you just said that. Yes, if you're a man, you are super good at ignoring your aches and pains. Just throw some dirt on it and keep going. You know, just rub some spit on it. It's going to make it better and you're going to be fine. But if you keep ignoring it, the problem is going to keep coming back, right? So some of you could be out there saying, you're like, but that's not the case with me. I had a shoulder injury 5 years ago, and I just didn't do anything about it, and I just let it go. And I haven't had any problems since then, or I've only had a problem a couple times since then. So here's the deal, is that no matter how infrequently you have this shoulder injury or this shoulder pain, be it after you lifted something wrong, or after you tugged on something, or maybe you slept on your arm wrong, and then you're attributing the shoulder pain to that. If you have shoulder pain, again, no matter how infrequently you have it, until you get to the cause of the shoulder pain, it's never going to go away. So just simply ignoring it is not going to fix the cause of the problem. So that's the step. Many people will ignore it, and then when the shoulder pain stops kind of going away so quickly, and it starts coming around more often, and it's more severe and more intense as you're dealing with it, that's when people will start to look at maybe some rubs. So maybe I'll use some BioFreeze, or maybe I'll use some Bengay, or maybe I have this issue just because I'm old. That's when people will really start to use like topical things, you know, to help their shoulder pain. Again, that is just covering up the problem. You know, you're just trying to take care of the pain in the moment, but you don't have shoulder pain because you have a lack of any of those rubs in your system. Does that make sense? Like, if your shoulder pain was truly caused by a lack of biofreeze on the tissue there, then the biofreeze putting on there would truly fix it once and for all once you put enough biofreeze on there. But that's ridiculous. You know, I think even just saying that, you can understand how ridiculous that statement is. Your shoulder pain is not coming from a lack of biofreeze in your tissues. Now, the biofreeze will help symptomatically, but again, do you want to symptomatically help your pain, or do you want to fix the cause so that it never comes back? So then once those topical things, those rubs and those creams don't work anymore, then you'll start to look at maybe taking some over-the-counter anti-inflammatories, some NSAIDs, like Tylenol or Advil or Motrin or any of those things. And then, of course, that will help when the pain is really bad. It'll help cover up the pain. But again, I'm going to ask you the question, do you have a shoulder issue because you have a lack of those NSAIDs in your body? And the answer is no. You know, if you've lived your whole life, you know, let's say you started having shoulder pain when you're 35 years old, right? And your whole life, you did not have to take NSAIDs to keep your shoulder pain at bay. So how is it that you went 35 years of your life without any shoulder pain, and then all of a sudden you turn 35 and you start to have shoulder pain, and then you start taking these NSAIDs, and you take them and you take them and you take them, and you think that's going to fix the problem? All you're doing is managing the pain. All you're doing is covering it up, and it is going to come right back because you have not fixed the problem. You haven't fixed the injury. All you've done is take stuff so you don't feel it anymore. So then when those NSAIDs stop working, the over-the-counter NSAIDs, and then you really start to, it really starts to bother you. You're losing sleep because of the shoulder pain. It's starting to radiate pain maybe into your hands, maybe some numbness and tingling, and possibly it's interfering with your work or some of your hobbies, or maybe you can't pick up your kids because your shoulder pain's so bad. Then what you'll do, finally, when your will is worn down enough, is you're going to make an appointment with your doctor, right? And they're going to look at you and they're going to say a couple different things depending on how old you are. They could say that you have shoulder pain because it's probably arthritic, because you're 50 plus years old, you're just getting older now, so that's probably the reason why you have the shoulder injury. Here's some, here's some meds to take, osteochondroitin. Here's some different meds that you can take. Again, medications to cover up the symptoms, but you're not doing anything to fix the problem of the shoulder pain. So none of those things are telling you what is the actual problem in my shoulder that's causing the pain, right? So then maybe they'll do, when that doesn't work, maybe they'll do some imaging, and they'll say, oh, yep, so there's some evidence of arthritis here, or they'll take an MRI and yeah, nope, your labrum's fine, your rotator cuff's fine, we can't see anything with the soft tissue, it's probably just arthritic in nature. And so then you're like really left there, and you don't have any answers again as to what the cause of the problem is, but then they put you on more medications. This time it's painkillers maybe, or muscle relaxers. And again, you don't have the shoulder pain because you have a lack of those medications or those painkillers in your body. You have to understand that. You're only covering up the symptom, you're not fixing the problem. So then years later, you're still having this issue and you're real sick and tired of dealing with it. And so then, you go to, you see an article about maybe how shoulder surgeries are getting way more efficient and insurances are paying for them, and maybe you see somebody, one of your friends has had shoulder surgery and their shoulder pain totally and completely went away. So then you go to your doctor and they say, you go to an orthopedic and they say, that's the word that I was looking for. You go to an orthopedic and they say, yeah. So I think that, we can go in there and we can clean up that arthritis a little bit. We can clean it up. And I think that's going to help you. So then you have yourself scheduled for that surgery. And then let's say you're out and about in the community, or you're listening to the radio on a Sunday morning and you hear this squeaky voice, Dr. Amy, talking about how shoulder injuries are coming from the spine, and you think to yourself, well, I don't really want to get cut on. I wonder if I wonder what is actually causing my shoulder pain, right? I've been through physical therapy. I've had injections into my shoulder. Now I'm scheduled for surgery. I've done all the medications. I've done all the muscle relaxers. I've done all the stretching they've told me to do. You know, I've ignored it. That didn't help either. And now it's really starting to affect my quality of life. And so, by the way, this is like a 20, 25, sometimes even 35-year process. It doesn't have to be that long, but for many people it is a longer, drawn-out process. And the whole time, what you need to understand is that, is your shoulder pain coming from your shoulder, or is your shoulder pain coming from your spine? 98% of the time, when I see somebody with shoulder issues, shoulder pain, their problem is not in their shoulder. And by the way, they've been through this whole sequence that I've just told you, and nothing is working, and they're scheduled for surgery and they still have pain, and they're hoping the surgery works, even though everything else that the doctor said was going to work hasn't, but they're hoping that this one last ditch effort, that cutting on it, is going to help. So 98% of people who have been through that, who have had shoulder issues, they always have a problem in their neck coming from the spine. And when there's arthritis or a loss of curve or a reverse curve or twisting of the spine in the base of the neck, that is going to make your shoulders take on more pressure than they're supposed to, and they're going to chronically be in pain. So you can put whatever rubs and creams you want on your shoulder, not going to fix the problem in your neck. You can put whatever injections you want into your shoulder, again, not going to fix the problem in your neck. You could even do all these stretches for your shoulder, again, not going to fix the problem in your neck. You could even have surgery on your shoulder, but that is not going to fix the problem in your neck. So what I'm saying to you is that 98+% of the time, if you have chronic shoulder problems, the problem is not coming from your shoulder, it's actually coming from your neck. And if you've never had that checked out and you're dealing with shoulder pain, maybe when you lie on it at night, it wakes you up because it's in so much pain, or your hand goes numb, or you can't lift your arm above your head, or you can't lift up your kids or your grandkids anymore. The first step is to find the cause of the problem. That requires a full evaluation of not just your shoulder, but also your spine, to find the root cause. My job is to find the cause and fix the cause, not just simply cover up your symptoms and help you manage your problem for the rest of your life. My job is to fix the cause so that your body can heal and you don't have to deal with these injuries, with these painful things, these painful joints anymore. Thanks for tuning in to that Best of Dr. Amy video. We will continue our discussion tomorrow, so stay tuned.